Hello, everyone. Welcome to Tongue Diagnosis Made Easy, Part 17, presented by Lamp AccuWellness Foundation, Inc. Pale tongues with depression at the root. With the help of the 8 principles and tongue diagnosis, acute and chronic patterns of disease can be analyzed quite accurately. Tongue diagnosis is used to gain insight into the energetic present condition of the individual. There are also tongue signs that inform us about the person's energetic past. These signs may include deep cracks, dents, hollows, or crevices in the tongue body, or a contracted tongue body. These and other changes to the tongue body, shape, and color, plus other specific signs, are most commonly caused by deep energetic deficiencies. For example, a chronic deficiency of spleen and stomach qi or kidney yin. Generally speaking, these deficiencies will over time lead to a depletion or insufficient nourishment of the essence. The essence is a very rarefied and dense form of energy that is fluid in nature. It has the potential for building and nourishing the body. It supplies the energetic material for physical and mental development in childhood and for the development and function of the reproductive system. The quality and strength of the essence is also of great importance in the production of marrow and in controlling the functions of the brain, bone marrow, and spinal cord. Finally, an increased output of essence is required to offset the shock and trauma associated with accidents. If one follows a regular lifestyle, the essence will decrease slowly and gradually decline in old age, accompanied by such things as the loss of acute hearing or loose or falling teeth. Young or middle-aged individuals, however, may also show signs of weakening essence. The most common causes are chronic inadequate nutrition, chronic overwork, chronic lack of sleep, too many pregnancies and births, births that follow too closely together, excessive loss of sperm, extremely profuse and frequent menstrual bleeding, serious chronic illnesses, frequent colds and flu, serious shocks, many operations, constitutional weakness, that is inherited illness or physical and mental disabilities, diets inappropriate to season, irregular eating habits in conjunction with overwork, insufficient rest after operations, infections, or other illnesses. The essence is responsible for the conservation and quality of substance. And a deficiency of essence implies loss of this substance, as reflected in brittle bones or loss of teeth. Consider the following example. A young woman had been suffering for a long time from anorexia nervosa. Her symptoms included the cessation of periods as well as osteoporosis. The tendency to starve herself had caused the exhaustion of the postnatal essence, which in turn failed to replenish the kidney essence. The young woman's loss of substance manifested in brittle bones. The practitioner is first alerted to a deficiency of essence by the patient's history and corresponding symptoms, as well as through specific pulse qualities. In order to formulate an accurate diagnosis, and prognosis, it is of great importance to assess the quality and strength of the essence. Alongside all the other collected data, the diagnosis of the tongue can contribute a great deal of information about the quality of the essence. Owing to its fluid nature and substantial qualities, the essence of yin in nature relative to the dynamic power of qi and yang, it thus has a strong ability to kidney yin. Because of this, kidney yin deficiency can lead to deficient essence. All processes in the body that lead to a loss of fluids, severe and long-lasting diarrhea, extreme sweating, or long-lasting febrile disease will eventually injure the yin. The loss of fluids and yin will produce dry, red tongues, as you can see on the slide, which can be an indication of severe deficiency of kidney yin and of declining essence. In clinical practice, these tongues are most commonly found in severely ill elderly patients or in those who suffer from a progressive cancerous disease. However, such tongues do occur in young people who have been affected by a wasting disease like AIDS. A red tongue can also reflect the development of intense heat, which can injure the yin. The more intense the redness of the tongue body, the greater the heat which has attacked the kidney yin and fluids. The interplay between kidney yin and kidney yang depends on the strength and quality of the essence and source qi. The essence through the kidney yang and the gate of vitality, ming, supplies the material necessary for the transforming and warming actions needed to produce kidney qi. The tongue coating is highly dependent on these actions. If the fluids are not transformed, either because of kidney yin or kidney yang deficiency, then the kidney qi is unable to rise to moisten the tongue. In extreme cases, this becomes visible in a very pale, swollen tongue body that is dry. Here, kidney yang is too weak to transform, manifested by the swollen body and transport the dry tongue, the fluids. This is rarely seen in the clinic. More commonly, a dry tongue appears as a result of deficient fluids, blood, and the stomach or kidney yin. However, the lack of tongue coating is primarily associated with the function of the stomach and spleen qi. The fermentation of solids and liquids by the stomach qi and the healthy damp climate of the stomach contribute to a turbid steam that ascends and becomes the foundation of the tongue coating. If the energies of the middle burner function without any problems, there will be an evenly distributed thin coating that is closely attached to the tongue's surface. A deficiency of stomach qi, stomach yin, and especially kidney yin can lead to a coating without a root. This coating is characterized by its uneven distribution, which gives it an old peeled appearance and looks as if it could be easily scraped off. The lack of a tongue coating coupled with a pale tongue body indicates a lack of stomach qi. This combination, plus the appearance of superficial cracks in the center of the tongue, may signal the onset of a decline in fluids and stomach yin. The root of the tongue corresponds to the lower burner, especially the kidneys. In general, The tongue coating at the root reflects the condition of the large intestine, small intestine, and bladder. The complete interpretation of the coating at the root requires knowledge of the patient's symptoms. An absence of coating at the tongue root or a red root reflects deficiency of kidney yin and exhaustion of the body fluids. A very red and dry root signifies that kidney fire has arisen from deficiency of the kidney yin. The texture and form of the root of the tongue also mirrors the condition of the kidneys. A contracted root, as you can see from the slide, or a depression of the root represents a deficiency of essence. These tongue shapes are the result of a loss of substance or material. As a result, the tongue lacks appropriate volume or shape. If the tongue root is of a normal color, the deficiency has not yet advanced to the stage of internal heat. An incipient lack of essence may also be associated with pale tongues. The incipient deficiency of essence manifests as a pale tongue with a depression at its root. It is as if there were a lack of substance to fill the root of the tongue. This condition is characterized by the combination of qi deficiency symptoms like fatigue, lack of appetite, sweating upon the slightest exertion, loose stools, as well as symptoms indicating deficiency of essence. Thus, fatigue may evolve into exhaustion that is not alleviated by regular sleep. There may be a lack of concentration, failure of memory, or head hair may turn prematurely gray. In such cases, it is not enough simply to tonify the qi. The essence, as well as kidney yin and yang, must also be nourished. The hectic lifestyle associated with modern industrialized countries can contribute to the premature consumption of essence. The earlier this can be detected, especially in young people, the sooner prophylactic and supporting measures by both patient and practitioner can be undertaken. As the following figures illustrate, it is possible to evaluate the condition of the essence and the extent to which substance has been lost by examining the tongue body shape and not just the tongue body color and coating. In these figures, pale tongue bodies that form as a result of essence deficiency are compared with those that result from spleen qi or yang deficiency or kidney yang deficiency. Let's start with the first case, 35-year-old female. Tongue is described as slightly pale, slightly swollen, slight depression at the root. TCM diagnosis, spleen and lung qi deficiency, slight deficiency of essence. Symptoms include exhaustion, insomnia, heavy feeling in the legs, tendency to catch colds, and coughing. Western diagnosis, mononucleosis, chronic fatigue syndrome following influenza. Background to disease is chronic overwork. Next, we have a 32-year-old female whose tongue is slightly pale, swollen, slight protrusion at the tip of the tongue, and slight depression at the root. TCM diagnosis, spleen deficiency with accumulation of dampness, slight disharmony of the heart, slight deficiency of essence. Symptoms, exhaustion, burning sensation after urination, severe cramping pains before and during menstruation. Western diagnosis, chronic cystitis, dysmenorrhea. Background to disease, chronic overwork, excessive use of willpower, 12 operations in childhood and puberty. Next, we have a 38-year-old female whose tongue looks pale, swollen, moist, deep depression at the root. TCM diagnosis: spleen qi and yang deficiency with accumulation of dampness, essence deficiency. Symptoms: exhaustion, restlessness, inability to fall asleep, profuse menstrual bleeding, prolonged red discharge after menstruation, feeling cold. Background to disease: chronic overwork, irregular eating habits, excessive consumption of raw foods, excessive thinking and anxiety, lack of sleep. Case history: Mrs. H, a 38-year-old mother of 4, found the demands of running the home extremely difficult owing to her continual exhaustion. She felt limited by her lack of concentration and drive and her depressive moods. Her hair was very thin, and she had periods of severe hair loss and often felt cold. Her tongue body was pale and swollen and presented a depression at the root of the tongue. Pulse was deep and weak. The many pregnancies and the demands of her family caused a severe exhaustion of spleen qi and yang, source qi, and essence. Her thin head hair and hair loss showed a deficiency of blood as well as essence. Forgetfulness and a lack of concentration arose from weakened essence, failing to produce sufficient marrow to fill the brain and nourish it. The depression of the root of the tongue confirmed this finding. The source qi of the patient was likewise weakened. The feeling of cold and the lack of drive were signs of the insufficient vitality of the yang. This was confirmed by the pale, swollen tongue body and deep, weak pulse. Over a period of a year, the patient focused on getting more rest, and with the help of Chinese herbs, her condition improved slowly but steadily. Note that the depression at the root of her tongue did not fill in. Exhaustion, which is caused by a deficiency of the essence or source qi, is different from mere fatigue in that short periods of rest or sleep do not improve the condition. By contrast, fatigue associated with spleen and lung qi deficiency benefits greatly from short naps or a good night's sleep. It is important that the patient be treated with Chinese herbs, take long rests, and attempt to change a hectic lifestyle. Next, we have a 43-year-old female whose tongue looks pale, swollen, and moist, with deep depression at the root. TCM diagnosis: spleen qi and yang deficiency, accumulation of dampness, essence deficiency. Symptoms: exhaustion, restlessness, inability to fall asleep, profuse menstrual bleeding, prolonged red discharge after menstruation, feeling cold. Background to disease: chronic overwork, irregular eating habits, excessive consumption of raw foods, excessive thinking and anxiety, lack of sleep. Mrs. R, a 43-year-old lawyer, complained about severe exhaustion. For years, she had worked 12-hour days, 6 days a week. Inevitably, her personal relationships broke down. Despite her fatigue, she was unable to sleep, and her nights were spent thinking and worrying. She occasionally felt pressure building up under her ribs and complained about inner restlessness. At the same time, her menstruation began to change. She experienced spotting that lasted up to 14 days. She had little appetite and was very thin. Her hair became noticeably grayer. Her tongue was pale and swollen and showed a deep depression of the root. Her pulse was frail, submerged, and hidden. Chronic overwork, irregular and insufficient eating had weakened the spleen qi in this patient. This led to accumulation of dampness as reflected in a swollen tongue body. One function of spleen qi is to hold the blood, but because spleen qi was deficient, there was constant bleeding. Owing to exhaustion of postnatal qi, overwork, constant worry, and lack of sleep, the essence and kidney yin were also affected, as reflected in depression in the root of the tongue. Since kidney yin and blood were deficient, heart blood and yin became malnourished, resulting in deficient fire in the heart. This led to inner restlessness and insomnia. Mrs. R also suffered from liver qi constraint, which manifested in occasional feeling of pressure under the ribs, result of her inability to appropriately express the anger and rage she sometimes felt. The liver qi constraint was not reflected in the tongue or pulse. Mrs. R was advised to change her diet, to include warm foods, and to eat regularly. Porridge or millet was recommended to start the day so as to strengthen spleen qi. She also introduced meat, fish, vegetables, and grains into her diet. Mrs. R was given weekly acupuncture treatments for 6 months, aimed at reviving her spleen qi, eliminating dampness, calming the spirit, and spreading the liver qi. The following acupuncture points were used. Stomach 36, LI4 and LI11 and LI10 were tonified. Fire needle technique was used for spleen 6, pericardium 6, liver 3, neutral, and spleen 9 and heart 7 draining technique. 6 months later, Mrs. R felt much better. Her menstruation had become normal. She slept well and felt much stronger. This was reflected in the tongue body color and shape. The tongue is now a pale red color and the swelling has disappeared. Her pulse is still submerged, but now has a noticeably wiry quality. As the patient's energy became stronger, the liver qi constraint became more obvious, as reflected in the tongue's curled up edges. Next, we have a 39-year-old female. Tongue is described as very pale, swollen, slight teeth marks, white coating in the center, and depression at the root. TCM diagnosis, spleen yang deficiency with accumulation of dampness, accumulation of cold dampness in the stomach, essence deficiency. Symptoms, exhaustion, fatigue, inability to fall asleep, epigastric pain with emotional stress, no appetite, intense feeling of cold. Western diagnosis, no findings, except that the patient was underweight. Background to disease, chronic overwork because she works at night, irregular eating habits, excessive consumption of raw foods, infection of viral meningitis 2 years ago. And finally, we have a 28-year-old female whose tongue looks pale, swollen, and big. Coating without root, depression at the root. TCM diagnosis, spleen qi deficiency with accumulation of dampness, stomach qi and slight stomach yin deficiency, slight deficiency of essence. Symptoms, exhaustion, restlessness, epigastric fullness after eating, belching, heartburn, loose stools. Background to disease, excessive sexual activity, irregular eating habits, and overwork. Thank you very much for your attention and see you on our next videos.